Okay, so in today's training, we are going to go over how to go from a small case to a big case, or maybe a patient that's come in just for a cleaning, and how to accelerate this patient into a higher level of treatment. Right, so I call this one tooth to comprehensive, but there's many different applications. Ultimately, the goal here is to help you take patients who need a higher level of treatment, get them interested, get them sold, and get them signing the treatment plan so they can move forward on that case. Anyhow, let's dive in. First things first, the foundation. This is really important. If you don't do this right, you might as well not do any other part here, because if you don't get the foundation, you're never going to be able to get this patient interested in something more. And instead, they'll just feel like you're trying to sell them something, which you kind of are. Because the reason is you can never sell a patient something new, you can only sell them something they already want. So, for example, if I only like German cars, right? You can't sell me a Lexus because I like German cars, right? Or if someone only likes Rolex, right? You're not going to be able to sell them a different type of watch because people like what they like. So when you do the foundation correctly, what it's going to help you understand is what the patient cares about. And then you can sell to that, help them see how your new treatment fits into their current priorities. So first things first, we need to have an understanding of your patient's clinical needs for the treatment that they've come in for. So if your patient needs a filling, that's easy. They've got a cavity, we need to fill it up. If your patient is coming in for teeth whitening, okay, that's an easy one. If they're coming in for a cleaning, we've got the basics, right? Beyond that, we then want to understand their emotional reasons for treatment, right? So if someone's coming in for teeth whitening, why do they care about that? Right? Is it because they have a very forward-facing career? Is it because one of their friends said, "Oh, your teeth look like they've been stained with wine"? Right? What is that driving factor? Even for patients who are coming in just for cleanings, they all have a reason why they take care of their hygiene. So if you find out what that reason is, right? Is this because the person really cares about having the best oral health? Are they health focused? Right? Is this person focused on aesthetics? But get a layer deeper. Why do they care about health? Right? Is it because they've had other health incidences in their family or with themselves? Why do they care about aesthetics? Are they trying to get into the dating scene again? Are they trying to advance their career? Were they criticized by someone? When you know this emotional reason here, it unlocks the key to going to a larger amount of treatment. So if you can't get this, you can't move forward, right? You need to be able to reiterate this back to the patient. So if the patient says, I want teeth whitening so that I can do better in dating, right? You need to be able to explain that back to the patient. I understand. You really care about your dating life. You're recently single. You're trying to get out there. You're trying to meet people, and you want to put your best smile forward, right? So make sure you reiterate that to the patient, because if you're right, they'll confirm. If they're wrong, they'll let you know, and then you can adjust and correct from there. Really important, do not move forward until you can complete this, right? If you don't have a grasp, obviously you should have a grasp of their clinical reasons for treatment. If you don't understand the emotional reasons and you can't explain it back to the patient, do not by any means move forward. Otherwise, you'll be trying to sell them something they don't want, they'll get bad feedback, and this won't work very well. Now, assuming that you've done that, you can move from the foundation to the step, right? And so this is where we're starting to present the next level of treatment. So we're going to mirror the foundation here, right? We've set a good foundation, clinical first, emotional second. We're going to do the same thing. So we're going to explain the clinical benefits of restoring more teeth, right? So maybe someone came in for teeth whitening, but they're missing one or two, and we want to present implants for them, right? Or maybe they have a very misaligned teeth, and we want to show them an orthodontic solution, right? We're going to explain the clinical benefits of the next level of treatment, right? And then we're going to do what's called a tie down. So the tie down is basically we're going to ask the patient if they understood what you just explained. And then you ask them, okay, what did you understand, right? So again, the cadence is, okay, here's what we're going to do with an aligner solution or an orthodontic solution. Here's how that would improve your smile. Does that make sense? The patient goes, yes. And then you ask, what makes sense, right? You say, do you understand? Your follow-up is, what did you understand? Basically, we're trying to get an open-ended question where the patient talks back to us. Remember, in the foundation, we reiterated to the patient their emotional needs. Now we're going to get the patient to reiterate to us in the tie down what we just explained to them. If they can do that successfully, it means they now understand the new treatment that you're presenting them, which is really important, because the biggest thing stopping your patients from saying yes is the simple fact that they don't understand the treatment. So we need to make sure that they can explain this very, very well. And if they can, then we can move forward. So next, you're going to then link the clinical benefits to their emotional reasons. So if you're showing them an orthodontic solution, help them see how that's going to affect their dating life, right? Connect the two ideas. Okay, if you had straighter teeth, you're going to be smiling ear to ear when you're sitting down for a date, right? You wanted whiter teeth for this, right? But what would straighter teeth do for you? And then again, we're going to tie them down. We're going to ask the patient, do you think this would help your dating life, right? Or if it's career focused, how do you think this would impact your career? Again, if the patient can't explain how the new treatment affects their emotional needs, they're never going to be interested in it. So we want to explain the connection and then ask them if they agree with that connection. Ask them why. Get the tie down, because if your patient starts to say, yeah, if I had a straighter, brighter smile, I would feel even more confident in my dating life. Now you're in a great position for them to accept that case and to move forward. So this is really, really important. You need to tie the patient down. Get them to explain in their own words, because that'll let you know if they're keen on it or if they're not, right? And if you don't know this, you're never going to be able to move forward. So always, always, always tie them down. Now, we've done the groundwork, right? We can have a more direct conversation. And this is the point where you ask them point blank, do you feel, it's an operative word there, feel, do you feel like this more comprehensive treatment, so in the example we're using, do you feel like this orthodontic solution will help you reach your dating goals better than just teeth whitening? Now, this is the golden key right here, because you need them to say yes in order for this sale to make sense to the patient. The way you get them to say yes is what we laid in the foundation earlier, which is linking the new treatment, the clinical benefits of that, to their emotional reasons and getting them to explain, right? We link and then we say, okay, do you agree with me? Why do you agree, right? Now, if the patient says, okay, yeah, I do think this is going to help me reach my dating goals even better, perfect, move forward, right? We're going to move forward the rest of this. But if they say no, pump the brakes here. No need to push anything, right? It would be a good indicator that you need to go back and look at what you did in the foundation. Did you actually get the emotional reason? And did you do a good job connecting that? And did you get your tie downs, right? If they say no, you did one of those 4 things wrong. That's your diagnosis. That said, once they say yes, now we can continue the conversation. We're going to tie them down again, and I would ask this exact phrase right here. What do you like about it? We want them talking more about what they like about the new treatment you proposed, because if they can tell you, I would like having a straighter smile for this and this and this reason, then you're setting up your treatment coordinator for a really successful conversation. Lastly, we're going to do a little bit of encouragement. We're going to let them know that we're agreeing with them. We're going to say, yeah, you're going to feel so confident. You're going to be able to post even better pictures on your Tinder profile, better pictures on your Instagram, right? You're going to get compliments from your potential dates. Give them something to hold on to, something that they're really going to enjoy. Give them some encouragement, right? So you're going to want to make sure that you encourage them, you agree with them, make them feel good about what they just told you. Then after that, smooth, simple, easy, just transition to your treatment coordinator for the financial presentation, right? So no need to talk about money. Say, okay, my treatment coordinator is going to come in and they're going to walk you through the financial conversation. So that's the process, right? We go from laying the foundation, which starts with whatever the patient came in for, be that hygiene, filling, teeth whitening, something simple. We get in sync with them on that, right? We understand their clinical reasons for wanting it. We understand their emotional reasons for wanting it. We then step up. We use those emotional reasons to logically link to a new possible treatment for this patient. And then we are critically getting the patient to explain to us that they see it too. Oh, okay. I see the clinical benefits of your new treatment. Here's why. I see how this would help me reach my emotional goals. Here's why. We get that by asking them, okay, what makes you think that? What did you understand? And then we're just having the direct conversation. Do you think that this new plan is better than what you just came in for today? Right? If you say yes, we're going to lock it in by asking them what they like, encouraging them, and then moving them to the treatment plan. So you use this checklist. I also encourage you to record your consults, right? You can get a release added to your new patient check-in. Record your consults so that you can then check if you followed this checklist correctly and diagnose what you did right and what you did wrong. So without any further ado, go ahead, use this, implement it. You're going to see that this helps you elevate more patients to higher levels of treatment so you can provide them more care and you can scale your practice.